I just would like to share the coronavirus update in Australia and hopefully give people some information and raise awareness about the danger of this virus. However, I believe the Australian government is doing the right thing and the quarantine standard is good in Australia at the moment. And we encourage everyone to keep an eye on this new update, which I'm going to include a link of the Australian government regarding coronavirus. And every day, the number of cases in Australia and worldwide is updated. I'm also going to feature a film of WHO regarding coronavirus, and I encourage you to watch it or watch it at the WHO website. So as you can see, the number of cases remain the same. It's only 12 cases and hasn't changed last 2-3 days. So there's no internal transmission to Australia. Therefore, I believe we're still safe, and therefore there's no need to wear mask in an open area. However, if you go to visit a hospital emergency or if you're worried in a crowded area, then maybe you should consider wearing a mask. However, if you can avoid touching your nose, your eyes, and your mouth, before you wash your hand, that will really help to prevent the spread of virus. I'll talk more about the prevention later on. So internationally, there are approximately 17,000 confirmed cases and 362 deaths. And usually those deaths are in China. I think there's only one death in Philippines a day or two before, and yesterday in Hong Kong. Therefore, we have to be very vigilant about the development of this virus. So I'm going to show you the film that I showed regarding the novel coronavirus, and I think this is very good. You can actually go to the WHO website, which I'm going to put a link at below to watch the latest news. However, WHO is a mix between health and political type of organization. Therefore, before they report anything, they have to check and check and check. Therefore, there may be some delay about their advices. For that, I actually must, give some credit to the Australian and US government for closing the border. Let's watch this.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They can...
So before we go over there, those cases were actually discovered by 8 Chinese doctors, and they reported it. But while they reported it, they were actually condemned as rumor spreader. So they were asked to write, letters of forgiveness to the government, say they won't do this again because they should not spread rumors, basically. However, later on, they were confirmed that they were not actually spreading rumors. They're actually discussing cases in their own, like a WeChat or WhatsApp group chat among doctors about new cases and just real awareness among the medical staff. Therefore, you can see that just by this simple case, we have to be very worried about the information given out by China, because they actually control information. For anyone who has been to China, you will know that you are not allowed to use Google or whatever because all the information is blocked. Therefore, whatever information comes out of China may be delayed, and therefore all the figures given out by the Chinese government, especially those infectious disease numbers, have to be revised. So let's use our common sense while interpreting the data from China.
So we need to get the facts straight.
What? Hey! Disappeared. Okay, I'll continue. continue.
Consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012.
So you can see the SARS virus and MERS virus are actually the similar type of virus as the new novel coronavirus in China.
The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries.
So you can see they were still thinking that may be related to seafood market. But if you read the recent Lancet paper published by those Chinese doctors looking after the first 40 patients, you'll find out actually quite a large number of patients have no association with the seafood market. So the origin of the disease is still being debated at the moment, saying that they were concerned about the delay of reporting about this virus and its transmission route. So they denied human-to-human transmission for quite a while. And by publishing this paper, they actually proved they actually knew this virus can be transmitted by human to human. And they knew about it way before they actually made public. That's why it's actually another reason why I have to interpret the data from China with a bit of common sense once you understand the Chinese culture. But I can certainly understand the need to maintain stability.
Where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, nCoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus.
I think regarding the original virus, there were actually certain links that's proven it actually all originated from bats. Like apparently they found certain bats that carried the same SARS virus as a SARS virus in China, from news I read, and as well as certain bats. I think the bats may have infected a camel that actually caused the MERS in the Middle East. Saying that I'm not I can't give you 100% proof yet, since it's not approved by WHO at the moment.
At risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction.
And also regarding the route of transmission, it's basically droplets. So if you sneeze to another person, if you have this virus, then this person can catch it from you. That's why wearing a mask is actually very important. You see me in this little tiny circle on the left hand side, you can notice how many times I touch my nose and my mouth while watching this video. We all do that, especially like I have a bit of allergies. So it's very, common for me to rub my nose. It's a little bit itchy sometimes, and that's a big no-no. That's why it's very important for you to wear a mask if you have this bad habit, or you should try to train yourself not touch your face or your mouth, because that is a really important way of transmitting any virus, even flu virus. Those masks we wear, the common masks, they are not virus-proof, but at least they can stop the big droplets, so it's better than nothing. I think hand hygiene and avoiding touching your eyes, nose, and mouth is probably the more important prevention factor in this illness. Also, there are actually proven fecal-oral routes. That means they found the virus in the toilet bowl from the diarrhea of the patient. Apparently, the patient may have some gastro type of symptom from some of the video I watched from China, went out from Wuhan. And therefore, it's very important to wash your hand after the toilet. If you touch the surfaces, make sure you wash your hands afterwards, or use the alcohol-based type of hand sanitizer. So another reinforcement: don't touch your eye, nose, or mouth before you wash your hand. Okay, let's continue.
People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected?
I must comment about this because there are actually quite a few cases that have no symptom at all. And we know that this virus is, it's contagious even before people show symptoms. I think that's why the Australian and the US government closed the border before they know more about the viruses. So I think if there's any negative comment about their actions in the internet community, I think we have to change our way of thinking about it, because I think it's like we should care for ourselves before we look after others. And until we know exactly what we're dealing with, it's probably safer to close the border first, make sure everyone's safe in Australia and whoever country that closes the border before we have the resources to help China. And I think ultimate goal, we really need to help China, because I think this disease is very serious. And maybe in another video we'll talk about it, how we can help China and the doctors in China, because they're really working hard to stop this illness, and they're not getting adequate help from their seniors on the top. Okay, continue.
The infection can be diagnosed by a test